Welcome to the Cyclical Doula podcast. I'm Emma, a certified SymtoPro instructor, a fertility awareness educator, and your guide to fertility coaching and reproductive health education from menarche to menopause and all the different types of motherhood in between. If you're seeking a natural, science-backed approach to managing your fertility, understanding your cycle, or simply connecting with your body in a new way, you're in the right place. Each episode is designed to empower you with the tools, knowledge, and confidence you need to thrive in your unique journey. Quick disclaimer, this podcast is for educational purposes only and is not medical advice or individualized charting support. For specific guidance, please consult with your healthcare provider or fertility awareness instructor. Now, let's dive into today's topic.
Welcome to the space where cycles breathe, where the real raw life of a mama leads. From motherhood's highs to charting the low, your body's story is the star of the show. Matriarch heart.
Hello. We're going to talk today about something that I think is wildly underrated in the typical health space, which is using your cycle, charting your cycle as a vital sign. So when most people think about charting your cycle, they think about it in context of family planning, right? To avoid or achieve a pregnancy. And it's really amazing for that. But the information on your chart for each cycle has so much more than just this fertility knowledge. It can really be a health report card to some degree. So every single cycle, your body's giving you data points, little clues that reflects what's going on hormonally, metabolically, and even in your overall well-being. And when you know how to read those clues, you can spot potential health concerns way before they show up on lab results or become a major symptom. So today we're going to unpack how your menstrual cycle is actually considered a vital sign, just like your heart rate or your blood pressure. Why changes in your basal body temperature, cervical mucus, and cycle length can tell you so much more than just your fertility, and some real life examples of conditions that showed up in charts before they were diagnosed. We'll also talk about some practical tips to help you start spotting your own patterns without getting overwhelmed. And by the end, hopefully you'll be able to look at your chart and think, my body's trying to tell me something here, and I know what to do with that information. So we're going to start with talking about how it's now recommended that menstrual cycles are considered the fifth vital sign. So in most health spaces, those medical professionals are taught to check things like your heart rate, your respiratory rate, your blood pressure, your temperature, and now going into detail about your menstrual cycle. And because just like those other measurements, your cycle can give direct, measurable reflection of your health. So when your heart rate is elevated, it can be a sign of stress, infection, or heart disease. When your cycle is consistently short, or long, or missing, or irregular, it can be a sign of things like thyroid disorders, PCOS, hormonal imbalances, nutritional deficiencies, and even chronic illness. So the menstrual cycle is a summary of how your body system are working together or not. Sometimes that's like short-term, just stress related, or long-term, like some of these bigger things as well. So what we generally consider normal in a healthy reproductive age woman who's not on hormonal birth control is a cycle length between 24 and 36 days, and that's relatively consistent month to month. We ideally want to see a luteal phase. That's the time from your ovulation to your next period, or like high temperature phase is another way that some people word that, of about 11 or 12 to 16 days. And then you want to see a noticeable cervical mucus pattern before ovulation with things like clear, stretchy, slippery mucus peaking in the days before you ovulate. And then you want to see a distinct basal body temperature shift if you're tracking that as well, usually about half a degree Fahrenheit after ovulation and staying high until your next period. And so when you track these things consistently, you'll start to know what's normal for you. And then that baseline is key because what you know is normal, you can recognize when something's changing. I've seen charts that there was the first sign of a thyroid problem, charts that have shown luteal phase defects before and a person had trouble conceiving, charts that have hinted at PCOS long before an official diagnosis. And the cool thing is you don't have to be a doctor to notice these clues. You just have to be curious, consistent, and willing to learn what your body's patterns mean. So now that we've set the stage, let's start looking into some of these common charting patterns and what they can reveal. When we're looking at charting on a specific basis, we can be like a health detective in all of us, right? All of us can look at these patterns on your chart and tell you so much about what's happening behind the scenes. A quick disclaimer though, spotting a potential red flag on your chart doesn't mean that you should diagnose yourself. What it does mean is that you have valuable real-time data that you can bring to your healthcare professionals for further investigation. Think of it more of like a heads up system, not a substitute for medical evaluation. All right, the first one we're going to talk about is a short luteal phase. So this looks like less than 10 days. It's on a chart when you've confirmed ovulation by a temperature shift or some other progesterone sign, but your period arrives less than 10 days later. And this might happen occasionally during a stressful month or during things like coming off of hormonal birth control or in that postpartum time. But if it's happening regularly, it's definitely worth noting. Possible causes of this short luteal phase could be things like low progesterone production. Sometimes that's called a luteal phase defect, thyroid disorders, things like inadequate corpus luteum function, which is related to progesterone. And then in some cases, things like nutrient deficiencies, especially for a lot of people, could be vitamin B. So this matters because a short luteal phase can make it difficult to maintain an early pregnancy if you're trying to conceive. But also, just you're not going to be the best version of yourself if your body is not having this healthy luteal phase for your hormone. I've worked with a client who had a luteal phase that was only 8 days long for multiple cycles in a row, and she wasn't trying to conceive at the time. But later, when she was looking more into it, she remembered those charts and brought them to her doctor. She was able to do some hormone testing and found that her progesterone was low, and that gave her a big head start on finding that out and having more support around that. All right, the second thing we're going to look at is low or erratic basal body temperatures. So on a chart, this is going to look like pre-ovulation temps, so at the beginning part of your cycle, that's low, sometimes below like even 97 degrees Fahrenheit. This is if you're taking your temperature like orally, not if you're using something like a temp drop. And temperatures that fluctuate wildly without a clear pattern. And then also something like post-ovulation temperatures that barely rise or rise inconsistently. So the first thing when we're looking at temperature data points, especially if they're low or erratic, is to talk about like what your temperature taking situation is like to make sure that we're eliminating all possibility of disturbances and human element to that. But if we rule out all of those things, then the possible causes of these low or erratic temperatures could be things like hypothyroidism or subclinical thyroid issues, things like adrenal dysfunction or chronic stress. It could also be inadequate progesterone in that luteal phase. And so low thyroid function can affect things like metabolism, mood, energy, and menstrual regularity. Often long before it's picked up on standard screening labs. So this is something again to keep an eye on and see um, if there's other symptoms that could be relating to this, and then just get some blood work done, see what your all levels of your thyroid are looking like, and being able to advocate for that testing can be because since you have this data point, could be really awesome. Number three, we're going to look at absent or minimal cervical mucus. And so what this looks like on a chart, this means little to no observable fertile quality mucus before ovulation, maybe like only some dry days or like a little bit of mucus, or a mucus phase that's extremely short, like 1 to 2 days max. And so some of these possible causes could be things like low estrogen levels. It could be a sign of dehydration or nutrient deficiencies. And then it can also be because of certain medications, things like antihistamines, um, and other things that would give you the like dry mouth symptom could also be uh, causing minimal cervical mucus. And then also one of the other parts of this cause could be being in that perimenopause phase. So without adequate cervical mucus, sperm survival drops dramatically, which can make conception harder and is a sign that estrogen may be lower than optimal in your cycle.
Hey friend, quick pause before we keep going with today's episode. If you've been curious about learning to chart your cycle, but the whole thing feels just a little overwhelming, I made something just for you. It's my 14-day charting challenge. It's a completely free experience inside my private community. For 2 weeks, you'll have the opportunity to go through simple daily practices that will help you tune into your body's natural rhythms without pressure, without perfection, and without needing to know anything ahead of time. You'll get a chart to use, 3 short, confident building lessons, and a supportive space where you can actually start to understand what your body is showing you. It's all bite-sized and totally doable, even if life feels super full. So if you've been wanting to learn a fertility awareness-based method or just feel more connected to your cycle, come join us. You can sign up at the link in the show notes or going to my website, emma.com, and clicking on the free charting challenge. All right, let's get back to the episode.
All right, the fourth one is long cycles. So this is something like longer than 40 days, longer than 36 days, 40 days, on a regular basis. And so this, for most people, this means that they're having a very long follicular phase, which that first half of your cycle before ovulation, having what could be considered a delayed ovulation or a cycle where ovulation might not be happening for months on end. So some of these causes, again, might be things like thyroid dysfunction or thyroid disorders. It could also be PCOS, which is polycystic ovarian syndrome. And then it could be hypothalamic amenorrhea. And this is often due to under eating or over exercising and or stress. So these conditions can have long-term impacts on metabolic health, bone health, and fertility, and charting them can catch them early. So not all of these things can be like fixed really quickly. A lot of this, having this information is going to take a lot of lifestyle changes and things like that. And it doesn't always mean that long cycles will go away, but having that information can be really powerful to know. The other One of the other things that we can see is consistently high temperatures. So if you're taking your temperature, your basal body temperature on a regular basis, and your basal body temperatures are consistently elevated across the whole cycle, not just after ovulation or like the beginning part of your cycle is high, like above 98 degrees. This could be something like low-grade inflammation or infection, um, including things like endometriosis. It could also be something, a sign of hyperthyroidism. And then if your temperature pattern rose, you had a biphasic pattern, and then it's continued to stay high for more than like 20 days, it could be a cause of, it could be a sign of early pregnancy. So persistent high temperatures without pregnancy can signal chronic inflammation or other underlying issues that deserve attention for sure. So these just a few of the common patterns that I see, and there's dozens of other ones from things like anovulatory cycles, breakthrough bleeding, spotting, things like that, that can tell you what's going on inside your body. And the key is knowing that these patterns aren't just random, that they're part of your body's feedback system. And when you pay attention, you can get an early alert system for your health. All right, so when we're talking about all of these charting patterns and what they might mean, we can take it a step further and explain why those patterns may be happening. When you understand what's going on behind your cycle, you can feel like you're not just memorizing rules, you can actually start reading your body's language. So let's start with progesterone, because it's the hormone that dominates your luteal phase. That's the second half of your cycle after ovulation. After ovulation, that follicle that released your egg transforms into the structure called the corpus luteum. And this little gland's whole job is to pump out progesterone. And that progesterone does two main things. It prepares the uterine lining for a potential pregnancy, and it raises your basal body temperature about a half a degree or more. And if your luteal phase is short or your temperatures barely rise, that can be a sign that your corpus luteum isn't producing enough progesterone or that it's breaking it down too soon. And low progesterone can be caused by things like thyroid disorders, inadequate follicular development, or even high stress because the stress hormones can interfere with ovulation quality. When we're looking at estrogen, estrogen's that star of the first half of your cycle in the follicular phase. As your follicles develop, they produce estrogen, and that rising estrogen triggers your cervix to produce fertile quality mucus, clear, stretchy, slippery mucus that helps sperm survive and move. And so if you see little to no cervical mucus, that means that your estrogen isn't rising as high as it should. And that could be from things like perimenopause, undereating, nutrient deficiencies, certain medications, or even dehydration. On the flip side, though, if you're seeing multiple patches of mucus in one cycle, it could be your body's gearing up for ovulation, not quite getting there, and then trying again, which can happen with like PCOS or during times of stress or illness. Let's talk about your thyroid. So, your thyroid plays a huge role in regulating metabolism, and that includes your reproductive hormones. So, low thyroid function can consistently cause low basal body temperature, a slow follicular development, and sometimes even prevent ovulation altogether. So, if you notice that temps are unusually low across your whole cycle, or that they fluctuate without a clear pattern, it's worth talking to your healthcare professionals for looking at a full thyroid panel, including TSH, free T4, and free T3, as well as thyroid antibodies. When we're talking about all of this, stress, whether emotional, physical, or environmental, can directly affect the hypothalamus, which is the part of your brain that signals to your ovaries. And this high stress can delay ovulation, lengthen your cycle, shorten your luteal phase, or even cause an ovulatory time where no egg is released. And this is why things like travel, illness, a major life change, overtraining can all show up on your chart. You might see a longer pre-ovulatory phase, more mucus patches, or temperature shifts that are less than stable. If your basal body temperature are running high across the board, not just ovulation, it might be your body's way of signaling a low-grade inflammation or infection. Your temperature can be affected by things like chronic illness, autoimmune conditions, or even subtle lingering infections. And that's why it's important to look at patterns over time, not just in one cycle. So one weird chart doesn't really necessarily mean anything, but a reoccurring trend can tell us a bigger story. So every data point you chart, every temperature, every mucus observation is connected to a hormonal or physiological process in your body. And your chart is basically this daily log of your endocrine, reproductive, and even immune system health. And when something's off, your chart's going to be the first place that you're seeing that show up. So once you've been charting and you've noticed these patterns and maybe even spotted a few things that seemed off, the next step is bringing that information to your healthcare professionals. Your chart's not just for you, it's a health record. It's something that the right professional can use to help guide testing, diagnosis, and treatment, and how you present it matters. When you walk into an appointment and hand over 3+ cycles of charting, you want your healthcare professional to immediately see the relevant information and not just feel overwhelmed by the data points. So making it easy for them, you can bring printed charts or a PDF that show the cycle length, ovulation, timing, luteal phase length, and temperature shifts, highlighting any unusual or reoccurring patterns, things like short luteal phases, long cycles, low temps, lack of mucus, those multiple mucus patches. And then include a short bulleted symptom summary alongside your charts. So, for example, things like your cycle length is 2 days or more on average. Ovulation is confirmed on cycle day 28 or later. Things like your luteal phase is consistently 7 to 8 days. Other symptoms include fatigue, hair shedding, dry skin. That way they can scan it and see the trends, and then you can have a conversation about that. And once you've presented your charts, you can make targeted requests for follow-up testing. And this shows them that you're informed, engaged, and ready to work with them. So some examples could be like if your temps are consistently low, to request a full thyroid panel. If your luteal phase is short or your temps drop early, requesting a mid-luteal progesterone testing 7 days after confirmed ovulation, not just on cycle day 21. And if mucus is absent or minimal, consider estrogen level testing and discuss nutrient support. If cycles are long or irregular, you could request an androgen panel, which is total testosterone, free testosterone, and DHEA, and possibly an ultrasound for PCOS. And then by matching those things to your chart pattern, you can make the conversation more focused and productive. Now, I'm going to be honest, not every healthcare professional is going to know how to interpret a fertility awareness chart, and that's okay. If you're sensor unfamiliar, you can frame it with, I've been tracking with some very specific signs of ovulation and hormone changes over several months, and I've noticed some patterns I'd like to check out. You're not asking them to become a fertility awareness expert. You're asking them to look at measurable patterns that correlate with lab testing or further evaluation, and you are your body's best expert. So your chart isn't just for diagnosis, it can be this powerful way to track progress. If you start a new medication, a supplement, or lifestyle change, keep on charting. Notice what is happening. Do your luteal phases lengthen? Does your temperature stabilize? Does your mucus quality improve? And these changes can be an early sign that the treatment's working, sometimes even before you can feel different. So bringing your chart to your healthcare professionals isn't just saying something's wrong. It's showing them this months of data that point towards what might be going on and giving them a clear starting point for that next step. All right, so let's just break down the cycle into those 4 phases and talk about what looks like a normal cycle in each of those phases so that you can know what might be off. So the first part is your menstrual phase. This is your bleeding at the beginning of a cycle. Ideally, we want to see it being 2 to 7 days. This is when your uterine lining sheds. Your bleed starts as cycle day 1. This is your reset phase where your uterine lining sheds. Healthy signs include things like bright red bleeding, a steady flow, and minimal clotting. If your period is extremely painful, heavy, or very light, this could be a huge indication of a hormone imbalance. Also, heavy bleeding, clotting, cramping, pain is not normal. It's common, but it's not normal. And that's definitely something to bring up with data points to your healthcare professionals. The next part of our cycle is the follicular phase. And this starts with that point of change of what's happening in your cycle when estrogen starts building up until ovulation. And estrogen rises, it's building this energy. Cervical mucus appears during this time. Studies show that the follicular phase is much more variable in length and ranging from 10 to 22 days in length. Ideally, we want to see um, it be around 4 to 8 days in length. Okay, the next part is ovulation. Ovulation is this estrogen and testosterone peak that often boosts libido and social energy. It's usually 24 to 36 hours of this ovulation. And when we're looking at this, sometimes we also refer to this as peak day in charting because we don't know the exact day of ovulation unless we have an ultrasound. And so this is also sometimes that last day of clear, stretchy, or slippery type mucus that follows from a definite change to a drier sensation. It's a good external marker for ovulation, and so those things that we look out for is something like painful ovulation or mid-cycle spotting. Those don't necessarily mean that something wrong is happening, but something to keep an eye on for sure. And then the luteal phase. So optimally, we want to see it between 12 to 16 days. And this is when your progesterone rises and you're after ovulation. And the other thing that we also see is that your luteal phase is much more consistent cycle to cycle. If, for example, you've typically had a 15 to 16-day luteal phase, but then had like a 12-day luteal phase, it might indicate an underlying issue. And so that might be worth looking into. The other thing that is important to talk about in the luteal phase is that PMS symptoms or significant mood shifts occur if hormones are imbalanced. And so if you're having severe PMS, fatigue, this short luteal phase, you definitely want to get some additional support in that as well. So when a healthy regular cycle is that 24 to 36 days long, it has ovulation, moderate PMS, and balanced bleeding. So things, again, the things that we're looking for most commonly are cycles that are too short, less than 21 days, or too long, more than 36 days. Severe PMS or mood swings, heavy bleeding or large clots, no signs of ovulation, like no cervical mucus or no temp shift. And then that your cycle should be predictable. So we're wanting to see that it's not going to be identical every month, but if you're noticing these irregularities, it's your sign to start digging deeper into it, to look into information around that. So I hope you're walking away with today that your cycle is more than just a tool for family planning. It's this living, breathing health log that can give you a head start on spotting imbalances, advocating for yourself, and caring for your body with confidence. You don't need to wait until you're struggling to conceive or until symptoms become impossible to ignore. Start paying attention. Your chart is a proactive health tool that can help you every single day. So today we talked about why your menstrual cycle is considered a fifth vital sign and what a healthy baseline looks like, common patterns on charts and what they might indicate, and then what you can do next is to start tracking if you haven't already. Pick at least one fertility sign. I always recommend cervical mucus first. Record it daily. Establish your baseline. Give yourself 3 to 6 cycles to see what's normal for you before making any big conclusions. And then note any lifestyle factors on your chart. Add in information about stress, illness, travel, or major changes so that you can connect them to your chart. Look for trends, not just one-off blips. So one weird cycle or a week of a weird information, it isn't necessarily a cause for a panic. Patterns over time are what matter. And then share that with your healthcare professional. So if you notice repeated patterns that could indicate a health issue, bring that to your next appointment and talk through that. No one's going to know your body better than you do when you're tuned into its rhythm. So charting takes you from being this passive passenger in your health journey to being an active participant. It's not about being perfect, it's about being present, observant, and informed. And that's one of the most powerful gifts you can give yourself. All right, if you're thinking, okay, I want to do this, but I have no idea where to start, that's exactly what I help with. So right now, I have some spots available to learn a fertility awareness based method. And I want to have you understand your cycle on a very specific basis. So you can schedule a free inquiry call with me at emma.com/free, and we can talk through what that would look like for you. Again, that's emma.com/free. The link is also in my show notes. And I'd love to just talk about what this could look like for you and see what the best option is. So remember that your body is always talking to you. Your cycle is one of its clearest voices that it has. And when you start listening, you open the doors to things like earlier answers, better care, and a deeper trust in yourself. Thanks so much for joining me today. I'll see you next time.
Thanks for spending this time with me on the Cyclical Doula podcast. If today's episode helped you feel more connected to your cycle or empowered on your fertility journey, I'd love for you to share it with a friend or leave a review. It really helps this podcast reach more people like you. And if you're ready to dive deeper, join my free Red Circle community. It's where we go beyond the podcast with exclusive resources, live Q&A sessions, and support for charting, planning, and thriving in your cyclical life. Visit the show notes to join the Red Circle today. I can't wait to see you there. Until next time, keep listening to your body. It's telling you so much more than you realize.